back to my channel, and if you're new here, my name is Maddie and I'm an ICU nurse in San Diego, California. I'm originally from Arizona, and I have been a nurse now for 7.5 years. I'm actually on call today for work, and I thought it'd be a perfect day to go through and answer some of your guys' questions. I recently opened up a question box on my Instagram at nurse.maddie and asked you guys what kind of questions you had about nursing, and so I want to go through and answer those. A little backstory on me: I originally graduated from nursing school in 2016 and started as a new grad on a neuro tele floor. Worked there for about a year, transitioned to CVICU where I worked for roughly 4 years, and now I have transitioned to a MICU, and I've been working there for the past 2 years. My answers will be kind of based on my experiences through my nursing journey. I have been a preceptor, a preceptee, a charge nurse, a resource nurse, a code nurse, so a little bit across the board on different things that I have done. Okay, first question. What exactly is a nurse residency, and is it a good route to go? Yes, yes, yes. A nurse residency program is basically a transition to practice for new graduate nurses. It's a program designed to help support you and give you guidance as you transition into your first job. I personally went through a new grad residency and I totally recommend it. As a new nurse, it can be really scary to just graduate from nursing school one day and have a job and have no type of guidance on how you should adapt into this new life change and new role. So residency program, most of the time mine was a year long with an emphasis on like 12 weeks with a preceptor. But a residency program will give you basically a framework. It'll give you a mentor, it'll give you a preceptor. Most of the residency programs will also have you meet off the unit, and so you'll have days where it's like educational in class, reviewing things, helping you get certain certifications you might need. So for me specifically, I was in a year-long program, and for the first couple months we would meet, I think it was like every other week, or like it was like either twice a month or once a month, and we would meet with all the new grads from each hospital, and we would just review the code cards, we would review hemodynamics, we would review typical like procedures that we would do at bedside, just to kind of get some hands-on with the equipment. It also allowed us to have more one-on-one time with our educator for the hospital, ask them questions. They helped keep track of our classic binders that have all of your competencies and your skills check-off. So totally recommend looking for a job if you are a new nurse that offers a new grad residency program. Question number 2, how to avoid night shift as a new grad. This one's kind of hard. I feel like each hospital is very different and each state is very different. I started as a new grad in Arizona and I got really lucky. I started as a new grad on day shift. I actually was offered both a day shift and a night shift position, and did take some days to think about it because there's pros and cons to both. I think that starting on day shift definitely gives you a more like throw you out of the nest and let you fly type of scenario where you're just thrown in and there is a lot going on. There's family members, there's procedures, there's interdisciplinary staff. There's just so much going on during the day that you really have to just like get up and go and learn, which can be really great if that's your style of learning. I also think that there's a good side to having new grads start on night shift because sometimes it can be slower. You can have some downtime where you can review charts and you can really get into like the nitty-gritty of your patient and how to prioritize and time manage. So I think both can be good, just want to say that. But I think if you are like dead set on day shift, you really need to be more flexible on the type of position that you're willing to accept. If there's a certain specialty you're wanting, it's not guaranteed that you're going to be able as a new grad to get the specialty you want plus get a day shift position. Not to say that you cannot get a position. Like I said, I started as a new grad in a tele floor and I was day shift, but I think that it's just more rare these days to find that, and you might just have to prioritize your goals when doing your job search. If you do find a job that you really like and you're really passionate about and they don't have a day shift position, I think that it's okay to let them know in your interview process that day shift is a goal of yours, and you can ask questions and ask them, what does the typical process look like for a night shifter who wants to transition to day shift? What's the typical length of time for a new grad nurse before they're able to transition? Roughly how many people right now are lined up wanting day shift positions? So these are very important questions to ask during your interview process to help you kind of guide if this is the right job for you. Do keep in mind that nursing is a great profession that allows you to move from specialty to specialty. So if you get your foot in the door on a day shift position, say at an outpatient clinic or on a med-surg floor, and you're really wanting a specialty unit, you can go and get the experience and work there on day shift for maybe a year and a half, and then take that knowledge and take that experience and transfer it over to a specialty position. That will also give you kind of a leg up in the next application process. Okay, question number 3. How do you reset when you're feeling burnt out from bedside? Burnout is such a huge topic right now, and for good reason. I think after the pandemic, people started to really feel the stressors of the job. For me personally, I think it's important to recognize what burnout is and what it means to me, because burnout to me might be different than somebody else. I think the common things that you think of when someone is burnt out is feeling lack of energy for the job, passion for the job, just overall feeling drained by doing a job that maybe you once loved. It's important to recognize these things and then also prevent you from getting to that point. And you can do this by setting boundaries. I think as newer nurses, we kind of lack that boundary because we want to be seen as a team player. We want to be seen as someone who will pick up the extra shift, who will attend all the meetings, who will go to the volunteer events, which is so great, and it is such a good mindset to be in. But at some point, you also have to realize these boundaries of your work and your life balance. If you're starting to trickle into that feeling of, I am just feeling like I can't do this, this is overwhelming, I'm stressed, I just feel burnt out from this, step back from the situation and try to pinpoint what exactly it is that is making you feel burnt out. Are you working too much? The people that you're working with draining you? Are you getting caught up in drama? Is it management? Is it the patient load? Is it the shift that you're working on, day shift versus night shift? So really do some reflection and figure out what it is that's making you feel this way and try to address that specifically. Overall, a good thing that you can do just to help prevent burnout, and things that I do, is making it a priority for me to live a healthy lifestyle outside of work. I make sure I'm exercising, that I'm getting outside and seeing sunlight, going for a walk, regulating my sleep schedule, which I'm still working on, making sure that I fuel my body with good food, and also just having rest time. I know if I work a stretch of shifts or if I'm feeling burnt out, my typical go-to is having a day off that is considered my couch rot day, and literally just do nothing all day, with the thought of knowing that the next day I'm going to get up, I'm going to get ready, I'm going to be productive, I'm going to exercise or do some kind of movement that's outdoors, I'm going to check things off my to-do list, and I'm just going to clean my space. If I have those 2 days back to back, I feel refreshed. Also, just remembering to use your PTO, use your sick time. You earned it, that's what it's there for. Whatever you think that you need, lean into that. Okay, number 4 is advice for a new grad that doesn't feel ready. First off, no new grad feels ready, so do not feel alone in that. Then there's a difference of having first aid nerves versus I absolutely do not feel ready to an unsafe point. So I think recognizing that is first important. A good rule of thumb is if you don't feel comfortable, speak up. Tell someone, talk to a mentor, talk to your preceptor, talk to your manager, because the people around you that have been training you, they will know. They know if you're ready. They can tell if this is just nerves, or they might say, you know what, why don't we extend your orientation another 2 weeks to help you feel more comfortable? Or what is actually making you feel not ready? Is it because you haven't seen a certain patient population? Is it I don't feel comfortable with my time management. I don't feel comfortable with the charting or, communicating with physicians, whatever it is. But also remember that it's okay to not know everything. No one is expecting you to have every single answer. So it's just important to know how to use your resources, where your resources are. Another thing I recommend is asking your manager or supervisor, whoever does your schedule, to put you on the same days as your preceptor or your mentor. having someone there that is experienced and that you trust and you know that you can go talk to if you have questions that come up or you need guidance on something is key. Both of the hospitals I worked at have done that, where they schedule the new grad and the preceptor on the same shifts for like a month after orientation finishes. It just makes for a more supportive environment. The last question kind of trickles into the next couple questions. There's a lot of questions about ways that new grads can ease their anxiety or tips for managing new grad anxiety, and also helping overcome pre-shift anxiety. So just anxiety as a whole. Pre-shift anxiety and new grad anxiety is so real. It's good to have some level of anxiety. You don't want to be like a know-it-all. I think that we're humans, and having that like little bit of anxiety, a little bit of like, ooh, like this makes me nervous is good. Because something I've done personally to help with pre-shift anxiety is having a morning and a night routine prior to my shifts. So the night before, I make sure that my lunch is packed, it's ready to go, and my clothes are laid out, and I have everything like set up so that way I'm not rushing in the morning. And then in the morning, I make sure that I'm giving myself enough time to wake up, get the things I need done, get ready, where I can calmly do it and not like hitting snooze 1,000 times. And now that I've been a nurse for a couple of years, I can't say that I've been as good at that, but definitely as a new nurse, I was like up way before I needed to be and getting ready, feeling good heading into my shift. I also would give myself some time on my drive and doing something that was calming heading into work. So I would listen to really calming music, I would listen to podcasts, just kind of like give myself some positive affirmations and, you know, put myself in a good positive mindset heading into the shift. Another thing that I think helped a lot, and I was a new nurse and fighting like pre-shift anxiety, was trying to work my shifts consecutively. I think this helped from a standpoint of at least knowing each day, like, okay, I'm gonna have the same patient tomorrow. You can spend a whole day getting to know that patient, kind of creating a rapport with them, rapport with their family, and that way you feel some of the anxiety, I think, of, being a nurse or being a new nurse is not really understanding like a disease process, or not being able to answer questions when a doctor asks you, or not really knowing what to do in a situation. And I think having your shifts back to back to back, where you're like, okay, I know this patient, I know what's going on, I can speak to something that happened a day ago or 2 days ago, that personally really helped with my anxiety. It honestly just helped with my confidence as a nurse. And then lastly, like I've stated before, is have a mentor. I think having a mentor is the best thing that you can do, or just having someone that you trust that's an experienced nurse. Because anytime you're feeling these things, you want to have someone that you can go to and be like, hey, I am feeling stressed. Having someone that you can talk to about that, and also create a plan of like, okay, how can I overcome this? Like, how can I grow from this? That is so, so important. Okay, number 6, favorite healthy snacks to bring to your shift. This one changes for me all the time because I go through different phases of things that I like. But I would say my go-tos are always a protein bar. I like the Go Macro bars. I have a joke that it's my emotional support protein bar because literally I have one in my single bag. I also really like to have fruit and yogurt. I think that's always a good go-to. I think it'd be easier, I'll just post on the screen like screenshots of certain foods that I like to bring. Okay, number 7. Advice on training someone who is difficult and doesn't listen, but management doesn't believe it. I believe that open communication is the best approach for situations like this, as well as utilizing your chain of command. I would suggest starting the conversation first with your orientee. Share what your concerns are and have examples of certain situations. Remember that when you're providing constructive feedback, to do it in a timely manner. Don't let something happen and then bring it up 3 weeks later. Be kind in your approach, and also give them positive attributes. Don't just hit them with, you could be better here, here, and here. Also tell them, like, these are things that I appreciate that you're doing. These are things that you're doing a great job at, and these are just some areas that I think we can grow together, and I want to help you. It's also important to make note of these conversations. So whether you do a end of shift check-in with each other, a weekly check-in, make sure that you are consistent with it, and so that way they know what they can expect. And this provides you a time to hear from them, hear from you, and then also have a documentation trail. if things continue to be an issue moving forward after having conversations and having these check-ins, then you can escalate it to your supervisor or your manager and have a sit down and say, hey, these are things we've talked about, these are things we've discussed, these are goals we've set, and I feel like we are still really lacking in this area, or whatever it might be. But at least you'll have some kind of trail of, these are the things that I have done, these are the things that they have done to help resolve the issue at a foundation level. Number 8 is nursing better in California or Arizona, pay-wise, environment-wise, etc. This one's kind of hard because I enjoyed both of my experiences, both California and Arizona. I think as a whole, California definitely has a higher pay, but I also pay more to live. I'm not really sure if it balances out. At first, I remember when I started my job here, I was like, holy cow, that's a huge pay increase. And then I saw my first rent payment. I was like, holy cow, that's a big increase. Environment-wise, I definitely noticed that with the union here in California, there are definitely more mandated breaks. In Arizona, it wasn't as concrete, you have to take a break, and there wasn't really a penalty for not having your break. Overall, I've been very happy with both hospitals I've worked at, so I don't have much to say. I think that from a ratio standpoint in Arizona, it's hard because when I was working in Arizona, it was also during the pandemic, and I think that it didn't really matter the state you worked in. I think that ratios just kind of got a little blended at that time, and so like I said, it's just a little hard. But I loved both California and Arizona, but I definitely enjoy California right now. Do you want to be a CRNA? For those who don't know, a CRNA is a certified registered nurse anesthetist. If you would have asked me this question 5 years ago, I would have been like, yes, yes, yes. However, now that I've been a nurse for many years, I think my priorities have kind of changed. I don't know exactly what I want to do. I'm still trying to figure that out, but I would really like to see myself either in a leadership role down the line or some type of educational role. Question 10, what is the hardest part about being a nurse? I genuinely just love being a nurse so much, but I think that overall the hardest part would be the mental and physical and emotional toll that it takes. And I think that at different points in my career, I've had different thresholds for that. And while the job is so rewarding and there's so many positives to it, it definitely can be challenging to care for certain patient populations, especially ones that, maybe are unkind or really don't want help. It's really hard to help people that just don't want to be helped. I think physically as well, just the long shifts, while I absolutely would choose to work 3/12s over 5 days a week any day, it doesn't take away from the fact that sometimes working 3 12.5 13-hour shifts physically is physically so hard on the body. I think emotionally, just the roller coaster of seeing critically ill patients, and emotionally on a positive side, the highs of highs, seeing patients who you're like, man, I hope they make it through this. We're gonna do everything we can, and just throwing, days and days of just hard work into these patients and seeing them recover. The emotional toll, just on the positive side, jumping to these patients that, unfortunately don't survive, or the quality of life, maybe we are doing so many things for them, but their quality of life is just, very poor. And so having that roller coaster of emotions, I think, is very hard toll. Mentally, just the aspect of learning and the risks that are associated with the job and trying to provide safe, competent care. And like I said, these are all just the hardest parts of the job. I think that any job has hard parts. For me, the benefit outweighs that. I think there's just so much passion and happiness and fulfillment I get from being a nurse and going to work and taking care of patients and seeing people get better and working with my coworkers and getting to be a leader and all these different aspects of the job. And so I would say that that's probably the hardest part, but it doesn't make me want to step back from the job. I'm going to stop here because there were still a lot of good questions, and I don't want this video to go on forever. And I think that a couple of these questions, I got a lot of questions about why I chose ICU, or how did you decide on ICU, why critical care, all those type of questions. I did answer previously in my ICU nurse blog. I talk about why I chose ICU. But I hope this was helpful, and I'm very grateful for everyone who is watching, anyone who submitted questions. If anyone has any specific questions, please feel free. You can comment below or you can reach out to me through Instagram. I really had fun making this video, and I will see you guys next time. Bye.